What is airway resistance in human breathing? Imagine trying to breathe through a narrow straw versus a wide-open pipe. The effort it takes to move air depends a lot on how wide or narrow your airways are. That's what airway resistance is all about. It measures how much your airways oppose the flow of air when you breathe in or out. This resistance affects how much effort your muscles need to make to get air into your lungs and push it back out. The main factor that influences airway resistance is the size of the airways. Think of it like a water hose. If the hose is narrow, water flows slowly. If it's wide, water flows easily. Small changes in the diameter of your airways can cause big differences in resistance. For example, doubling the radius of an airway makes resistance drop by 16 times. That's a huge change. So, when your airways are narrower, it's much harder for air to pass through, and your lungs have to work harder. In your respiratory system, the medium-sized bronchi are the main players when it comes to resistance. They have the smallest radius and contribute most to resistance during normal breathing. But the tiny terminal bronchioles, even though they are smaller, don't add as much to resistance because they have a larger total cross-sectional area. Several things can change airway resistance. The smooth muscles lining your airways can tighten or relax. When they tighten, a process called bronchoconstriction happens, making the airways narrower and resistance higher. When they relax, called bronchodilation, the airways open wider, lowering resistance. The nervous system controls this process. Parasympathetic nerves cause constriction, while sympathetic nerves cause relaxation. Inflammation and mucus buildup also play a role. Conditions like asthma or chronic bronchitis cause swelling and mucus in the airways, which narrows them and increases resistance. When the airways are inflamed or clogged, it becomes harder for air to flow smoothly. The type of airflow matters too. When air moves smoothly in a straight line, called laminar flow, resistance is low. But near airway branches or when airflow is chaotic, called turbulent flow, resistance jumps up. During breathing, airflow is usually laminar in the smaller airways but can become turbulent near larger branches. Lung volume changes also influence resistance. When you breathe in deeply, your lungs expand, stretching the airways open and reducing resistance. When you breathe out, the airways slightly narrow, increasing resistance a bit. Understanding airway resistance helps explain why breathing can become more difficult in certain conditions. If resistance is high, your respiratory muscles need to work harder to keep air moving. This concept is especially important in diseases like asthma, where narrowing of the airways makes breathing more effortful. In simple terms, airway resistance is how much your airways oppose airflow during breathing. It mainly depends on how wide or narrow the airways are, how relaxed the muscles are, and what's happening inside the lungs. It plays a big role in how easily you can breathe and how your body maintains proper oxygen and carbon dioxide levels.